Our goal with our ALEX Emergency Medicine project is to provide learning to our busy medical students and residents whenever and wherever they go. The mobile curriculum gives them high-yield learning topics like ultrasound, ophthalmology, EKG cases, and a basis for online journal club through our Lip Bank. The Case of the Month series, which is a favorite amongst our residents, is an interactive blog about an interesting case seen by one of the residents and a discussion between both faculty and residents on how to manage the patient. Podcasting our morning report allows us to reach a greater audience of students and residents by providing weekly recording sessions of our Monday morning report cases, which we can then listen to later at our leisure. ALEX optimizes on the use of technology to provide our students and residents with a wide range of education. What do you use ALEX for?
To connect to access emergency medicine.
I like to look up articles on recent literature.
I use it to look up the case of the month.
I use ALEX to look up important articles in the field of emergency medicine. Basically, if I have an issue, oftentimes I look there first because they've collected a lot of articles that are useful for our practice on a day-to-day basis.
I'd like to use the most right now is the case of the month and being able to discuss anything with interesting findings or important pertinent positives, and also getting the involvement of the attendings and residents and kind of discussing medical practices. I think it's been enjoyable.
So we use Case of the Month on our ALEX website every month, essentially to bring up a new case, something for discussion amongst the residents. It's really good because you can have online discussion in a forum setting. People aren't intimidated by using the website at all. And these cases can range from anything with an ultrasound cases, which I did this past month, or it could be cases with interesting EKGs or trauma cases, and it's really just a vignette and then some vitals and laboratory work. And then, you kind of ask the resident group, what's going on with the patient, what do you think is happening, what's appropriate management, and at the end of the month someone comes up with, whoever's doing that case of the month comes up with the answers in a discussion. It's a nice way of people to learn, not be intimidated as they are in oftentimes small group cases.
So I think ALEX is a great tool. It gives the residents a way to learn outside of the clinical setting, and more importantly, outside of the didactic lectures that we do once a week. I think it gives people the opportunity for continued learning, allows them to learn on their own, and it has a lot of different usefulness. So we can put lectures on there for people who can't attend certain lectures. We can put our morning reports on. We can also link to different research articles. We can do things like EKGs and x-rays. It's really a great flexible tool, and all it really requires is for people to use it, and I think it has great potential to educate residents.